Mommytrack Daddy Whispers Podcast is now called Birth Agni Podcast.
Welcome to Mommytrack Daddy Whispers Podcast, Season 3.
You take your mom or your sister or somebody to go with you and will carry the baby and support. I think every time these kind of follow-ups should be done with your partner. Dry vagina. It may not be psychological, but your vagina can be so dry because you're breastfeeding.
Hello, my name is Divya and we are back with yet another undiscussed topic, vaginismus. A fairly common condition which is usually hushed and pushed under the carpet, creating a ripple around which getting the right care becomes difficult. And hence here we are today with Dr Nivedita Manokaran, who is popular by her Instagram handle Dr Nive Untaboos and has been working to create awareness about sexual health issues as well as creating a more sex-positive atmosphere. Let's dive deeper into our conversation. Hi, Dr. Nivedita. So good to see you. Good morning.
Hi, thank you so much for having me, Divya.
Dr. Nivedita, you have been working as a clinician in sexual and reproductive health and HIV medicine for almost 11 years now. And I was going through all the podcasts you've been on and the stuff on your website. And, the irony there was that you wanted to pursue dermatology, and it was a combination course. It turned out to be you started working in this space when you went to Australia. So what changed from India to Australia?
What changed was I discovered something that I did not get. And I discovered something which is so important. And I was starting to feeling so important being a part of a healthcare system which is so tabooed and people are so silent and shy about it. And there's a lot of shame that goes along with sex, not just in India, but also in Western countries. I think we assume that people are okay to have sex, but honestly, the word sex, I don't know how, unfortunately, throughout the world, I think goes around with some kind of judgment or some kind of embarrassment. And also because I think it's a personal space. So I felt really good being able to be that trustworthy person in somebody else's, personal space. And I think that kind of fed me into, I like this. And I thought, this is what I should have had as a youngster growing up in India. And I kind of almost regretted that my venereology degree that I qualified from India probably should have had this as a training. This is how I should have been trained. And I also had this guilty element, which kind of felt like I never asked any of the teenagers or anybody, who appeared unmarried or less than a certain age, the right questions. I never asked. I was never taught to ask the right question. In fact, I would be diagnosing STI, right? And I think that kind of made me feel very guilty that how many STIs have you diagnosed in probably a young person and did not ask them if it was consensual sex that they were having, did not ask them if they have a partner that needs treatment, didn't ask them, what is your contraception? Do you need something in place or are you okay? So all these things, when I was taught, when I came here, actually took my breath away. And I thought that is such an important part of everybody's life, whether it's man or woman, right? Sex is such an important part. And I was absolutely fascinated. And I thought I should do something different. I thought, okay, let's do this. And that's how, like I tell people 11 years down the lane, I'm still here doing the same job with absolute passion, absolutely love it. And I was looking for an opportunity to actually come to, India and how do I give it back to the country that I've missed out kinds. But then I think COVID was like a blessing in disguise. Where it started making me realize that how people are, using, social media platform for actually education and how I start, like we are doing everything working from home and teaching is happening from home. Universities are run from home. So I kind of thought that's nice because I can do it from wherever I am. Doesn't matter where home is, really, isn't it? So, so that's how it all started and that's how it's all going. And yeah.
My folly. When I did not, study about you, I thought you're in India, because all the, knowledge from you that I see on YouTube and all other places, I thought you're in India. But when I started reading on your website about you, I was like, yes, you're in Australia. That's why, the time we had to choose.
Time different. Yes.
Yeah.
I try. I push myself up to, I think, almost 11 p.m. at nights. But sometimes I think it demands that I have to be there at 2 a.m. and 3 a.m.
Oh my God.
And I fail. I should say I fail a lot of the times. I just don't do it because, I do have a real job as well. And I have children to raise. So it kind of gets really on the way.
Yeah, I think prioritizing yourself is actually winning somewhere along the way. It's actually prioritizing stuff in it.
The balance, isn't it?
Yeah. Absolutely. Dr. Nivedita, you must be seeing patients. We are discussing vaginismus today, and you must be seeing patients with this condition in your clinic. Is that?
Yeah, like we see a lot. Pain during sex, we see a lot. That it's almost funny how a lot of the women think that it's normal. A lot of the women think that that's how it's meant to be, because I think sex is painful for women. They almost start believing that's normal for them. So that's how common it is, actually.
When I was going through a lot of forums, there was this, one of the questions that was on one of the forums was that I'm having sex for the first time. I know it's supposed to be painful. That's what I know from people around me. But I've also read about vaginismus. So is it that there was a lot of confusion, and a lot of the forums also said it's just psychological, it's just in your head, will get better with time. And one of the comments was also that since you know about vaginismus, you might be suspecting that you have it, you might be manifesting. So I was very wary of, when we put this information out, for the listeners to not start manifesting something they do not have, yet know exactly how to assess what is vaginismus, and if they have it, they should definitely find a cure, because like you said, sex doesn't have to be painful as it is. So what is vaginismus in the first place, and how does one assess if they have it?
Wow, I think that's very important, what you've just brought up. And I think I'm going to start off, like you said, everything that you've said exists, and each one of it is different. And that is what I want to address. So like you said, when the first time people are having sex, let's just say, and they are worried that is it going to be painful, they almost expect it to be painful. I always tell people, you have to remember, sex is pleasurable. Sex is joyous, and sex is always nice when it is consensual and when you actually like someone. When I say like someone, I think love is an overstatement, because you don't have to be in love with the person, because if you're going to have casual sex, you actually, spoke to someone that evening and you're going to end up having sex that night, which does happen these days. You still have an attraction element to the person. You still have a consent that you want to do the act, and that is very, very, very important. I mean, I can't emphasize on it enough, because when you actually willingly wanting to do it, you're actually attracted to this person. There are a lot of hormones that's already geared up within yourself that is kind of easing everything that you have, including your vaginal muscles, getting your vaginal discharge ready, and kissing or holding hands or foreplay. All of these things play a very, very important role before someone gets into having sex. And I mean, unfortunately, when people are put to probably, sexual assault or abuse, and that was the first time, and that is how penetration happened, then yes, can be terribly painful. And then yes, it leaves you with the mental trauma as well. And your body kinds of shut down, and then causes what is vaginismus, because it doesn't allow anything to come in, because the first time the experience has been not only physically painful, but also mentally painful. So that is how vaginismus happens. It does not necessarily have to be sexual assault or rape. It could be something that you didn't want or like. Like, for example, it could be an accident that you hurt yourself so hard, in your genital area that, it was traumatizing. Or it could be a vaginal examination, which you had to do, or there was some pain or bleeding, or somebody had to examine vaginally, which caused a lot of grief. So there could be anything that caused pain down there in your vagina. that then led to a traumatic experience, both physically and mentally, and then that leads to vaginismus. That is different to the initial discomfort someone has when they are starting to have sex. And like I told you, if there is physical attraction, if there is consent, if there is a lot of foreplay, and I always slide this in, if there is a lot of lubrication, if you don't have, use a lubricant, because it's so good to have it just slippery and slimy, because it doesn't hurt. It's good to do it that way. So if you've got all this happening, yes, it could be a little bit uncomfortable because it's a feeling that you're having for the first time during your debut, but definitely there is more pleasure element than discomfort or pain element. So I think that's what you have to understand when you're going through your sexual debut. And then your vaginismus is different. So vaginismus is basically your body and your vaginal muscles and everything contracting and shutting down and saying that was a painful experience, no more. So that is vaginismus, and that is really painful sex where your muscles are just not relaxing and people are not able to penetrate, and it's extremely painful and it's awful. And I always tell people, because they're reading a lot about vaginismus, like you said, there are two things. One is you're assuming or you're self-diagnosing yourself. Anything that happens, there's a bit of a pain. People are like, oh, I Googled it. And painful sex is you're going to have words like vaginismus, vulvodynia, dyspareunia, and, all these things. And then, of course, Google just says that you have all of this, right? Yeah. So I always tell people, if you've got some symptoms and you're concerned, the best person to actually diagnose you, even if you have vaginismus, is probably your doctor. Because there are so many causes for vaginal pain. Like you can have really dry vagina, which needs a lot of lubrication. You can have sensitive skin around the vulval area, which leads to cuts and stuff when you're having sex, which can again lead to pain. It doesn't necessarily have to be vaginismus. You can have some infection that, like thrush or yeast, that makes it really like dry and red and itchy, could lead to painful sex. So there are 1 billion things which could actually make your sex uncomfortable or painful. So it's good to see a doctor, have her examine as to, I can do a swab for thrush. I can look at the outside skin to see if there's any cuts or bruises. So I can do all medical things to rule out that there is no medical cause for that pain. And then we address as to what happened or what's happened in the past. And, I talk them into seeing a psychologist, and then I refer them off to see two important people. One is your pelvic floor physiotherapist, which is very, very important part of vaginismus. And second is your psychologist or psychiatrist, depending on how, your trauma or what has been in the past and what you need and stuff like that. So I start off with psychologists and encourage them to do that, and then see a physiotherapist as well, where you have to start doing, exercises that relax, use products that lubricate a bit more, all of that. So it's a kind of an effort. And that's how we work towards vaginismus.
Yeah, thank you so much. I had this question written for me that...
Sorry, I think I just summarized everything in the one answer.
We can definitely elaborate on, on a lot of these things. Thank you. So it's important to have those hints right there. And vaginismus can be anatomical. It can be purely psychological, or it can be a mix of both. And it's a gray area.
Vaginismus is a lot of the time, so vaginismus can be divided into primary and secondary vaginismus, definitely. So primary vaginismus is, it's not possible to penetrate even the first time up. Nothing even happened. Like, how I'm talking about something has happened that has led to the, pain. There could be primary vaginismus where nothing has happened like that, but then everything is contracted and tight and nothing is going in first up. And that could be, I think when you say anatomical, I think you're trying to say physiological, a normal thing without any pathology behind it. And yes, that could happen that way. And that we have to, like I said, look at it, what's going on, examine, see if it's like anatomically, if things are narrow or if there's any kind of tightening, then work on loosening and stuff like that. And the secondary vaginismus is the one that I have spoken about, where something has happened that is traumatic. And then this happens secondary to it, which is a lot of the times psychological than physiological or pathological.
And it also goes into a cycle. So if you have anatomical vaginismus and it was very painful, very, very bad, it might put you on a cycle of not wanting. Secondary.
It can absolutely, because the first time you tried and nothing went in, and the second time you want to try, you think it's going to hurt, it's going to be awful. It's a lot of work. I feel like it's a team effort. You need a sexual health specialist or a gynecologist to examine you and reassure you and tell you that it's okay, I've had a look and stuff. And then you also need a psychologist to go through what's going on. And then you also need a pelvic floor therapist or pelvic floor physiotherapist who's going to work through all those muscles and relax. And it's kind of like a stimulus that they work on, the vaginal muscles, and telling your brain that it's not going to be that painful. And they let you do, there are dilators that are available. There are beads that are available, which, they let you use it yourself slowly, kind of making you feel like you're in control of what is going in or how much is going in. Because sometimes when traumatic things happen, it's all about you had no control over it. And that could be really painful. So it's very important to start taking control and start feeling like you're doing it. You're allowing things to go in the pace like how you want, and then gradually easing you up, relaxing. And also it's very important that now you're doing it with someone who understands this, who's not getting frustrated with this, and who's being a part of it, who's happy to still do the foreplay or kiss you or do all of that. That kind of is a part of therapy where your vaginismus will ease up. Instead, if you're having someone who is being rude to you or dismissive of your feelings or what's happening in your body, or not understanding, and that doesn't help. That only traumatizes you or stresses you even more, in which case it can get really hard in relationships. So it's very important. Partner support, then helping you through this, is very, very important.
Right. And a lot of dilators these days are available online. On a lot of these forums, people are like, use this dilator, go like that. Is it okay to get things online and try it yourself? Is there a home method to working on it? Or you would always suggest to have a combination of a physiotherapist and a psychologist, so that, it is said that it can be a painful procedure to release yourself from vaginismus?
True. Look, I'm a person who believes in support system. I am not someone who shuts myself down and tries to figure it all out myself. So I am big on reaching out. Like, for example, if you're reaching out, like when people reach out to me for vaginismus, we give them like information and links on where there is vaginismus support group, where there are other women who are actually talking about it. And the other women can talk about techniques that probably worked for them. And this person can use it too, all kind of things. So I feel like support is not just seeing a doctor or not just seeing a physiotherapist. There's more to there's more to support. But at the same time, if you are going to buy products online, I understand, and you're going to use, I always recommend people to start and be a little bit more sensible rather than just explore big size things and, big toys and big stuff. Rather than dilators, probably masturbation is actually a really good thing that women can do for themselves to ease them up, both in terms of sexual feeling and in terms of the vaginal muscles or whatever. So you can start off honestly with your finger. You don't have to invest in dilators, because have you seen a dilator? It pretty much looks like a finger and then possibly as big as a penis. That's pretty much what it is. Exactly. So you can honestly start off with slowly using, a good lubricant and a finger. To start putting a finger in and see if then one finger goes in, you can start with two. Honestly, that's both masturbation or dilating or whatever that is you're doing, it's great with doing it with your own fingers, So you don't have to invest in something. I would at least get an opinion and suggestion from whoever it is. Your doctor can tell you that, these dilators are good. I want you to buy these 2 sizes. Try this one with the lubricant. Then you do, your doctor might be good enough and she might feel comfortable, or he might feel comfortable to be able to explain how to do that. And that might be enough. I always tell people, rather than, doing invasive things and Googling and going with internet, go and reach out, because reaching out, even if it was just for the one time, reaching out is very important, because honestly, all the healthcare professionals that I'm talking about now have spent years in specializing what we do. It's slightly different to Google, I'm sure. So that's me. I personally would do that for myself. I'm not someone who will Google or buy anything online. When it comes to me or my children, there's always another doctor that we go to and get advice and care. And I might know it's a ear infection and he needs an antibiotic. I will totally know it, but I definitely always take him, to get the opinion and get proper prescriptions from another person rather than me trying to scribble stuff for people. So so that's just me.
Yeah, that absolutely makes sense. So all the doctors have their own practice set, their own, periphery of practice. So if a doctor is referring you to somebody, I think that is a good way of assessing that he or she is a good doctor, because, when it goes out of the periphery, they're sending you to someone else.
They should, yeah. I think it's a skill, doctors need to know what is my skill. And when it is going par my skill, I have to stop and refer out. So, yeah.
Yeah. So another thing which was on my mind was that, like you mentioned, a lot of partner support is required. A lot of emotional support is required. There were cases of people not going out to anybody, speaking about it, because they were shamed. They felt guilty. They were like, this has to be like it. I'm sorry, there is a problem with me and it's just me. There's nobody else. So these support groups out there on different social media platforms are absolutely bliss. When you see so many people have it, you're like, it's not me. It can be so many people. So it's not just, I don't have to be ashamed of it. It's a part of my body. I have to accept it. Sexual health education is such a taboo. How do you think one should approach this situation, especially when it comes to partner support and, family support, sisters and all the people that are comfortable with? What do you think? How should one approach the situation?
I think that's where your professionals come in place. So like I said, what I do is I am probably examining you and clinically making sure there's no lumps, bumps, cuts, or nothing, like physiological, anatomical that's there that is blocking or giving the pain, and no STIs and stuff. I'm doing all of that. And once I've done that, I do refer people to the psychologist. And our psychologists here always do, like, it's because it's STIs, there's always another person involved, and we have to understand that. And not many people have, like you said, great knowledge about STIs or education. So we always involve the partner in education. We always do, especially when people come with, diagnosis of herpes or blood tests for herpes, and everybody's freaking out that, do I have herpes? And we have such long sessions both to the partner about what this means, because a lot of the times it's relationship saving. Honestly, we save relationships with these kind of counseling. I mean, I know people say, why can't we just no, because it's a big thing. And similar way, like with vaginismus, when we have a person and a partner who has no knowledge about it, they might have a beautiful relationship, which we definitely don't want to get spoiled because, the sexual life is a little bit strained at the moment. A lot of the people, I think, in India especially, might say, well, sex is not everything, and what partners can still like each other. Well, let me be honest. I don't know about sex being everything, but it is definitely a very, very important big thing. I don't know how many people are in denial about this. Yes, you can absolutely love someone without it. But if it's someone that you need, or in the beginning of your, reproductive life or sexual life, it is very, very important. It is important for your relationship, the dynamics, the mental health. And that's why, I emphasize partner understanding what's going on and trying to work towards it, accepting, we want to have sex. We want to have pleasurable sex, and accepting it rather than, coming up with stuff like, oh, sex is not, oh yeah, of course it is. It's very important. And we all know it. We are a country of 1 billion. Yeah. So I don't know what people are talking about when they say sex is not. I'm like, oh, sure it is. And I think that's where it's, sorry. What were you saying?
I was saying also respect. So sometimes, like secondary vaginismus is also after you've delivered. It was a painful birth. And a lot of women refrain from because they've undergone a lot of changes in their body.
Trauma, no? The pain is horrendous.
Yeah, it is. And respect is very important because it frees you. It allows you to go out of your own inhibitions and maybe try. So sometimes when it's just in your brain, and a partner is supportive, it's like, okay, I'll wait for it. If you
Absolutely. No, and I think that is why partner education is important. When, like you said, when we're talking about when women have had babies, when you go back for follow-up to see your, gynecologist or something, usually, you take your mom or your sister or somebody to go with you and will carry the baby and support. I think every time these kind of follow-ups should be done with your partner. Because it's very important, because he might have some questions as well, or he might want to know as well. I mean, I know both men or women can hesitate to ask your doctor as to, when can we have sex? But that's a very important question. And it's good for you or the doctor herself to address it in front of both of you. Because like you said, with, men understanding or trying to be supportive to their partner is important. And if they don't know, if they don't have the knowledge, we can't just blame them, or we can't just say you should have understood. How are they supposed to know? They don't know these things. Probably they are first-time fathers as well. So rather than, assuming and blaming that this is what men should do, I think educating them and making them inclusive of what is happening is important. And that is why I think, it's amazing here because they do it all the time. Yeah, every time you go for your gynae consultation or obstetrics consultation, your partner goes in, the partner is there throughout your labor. He just sees how painful, it could be. And then your partner goes for follow-up appointments as well to say it's going to take some time. She's got a tear or she's got sutures down there, and stuff like that. And after that, women have to go back and tell the gynecologist, I'm not enjoying it anymore because it's still painful. Because if it is, sometimes you can have a dry vagina. It may not be psychological, but your vagina can be so dry because you're breastfeeding. It could be like dry, and honestly, people think, what's happening? My wound is healed, and why is it still hurting? It's still hurting because it's dry ass. And sometimes it could just be a matter of throw a bottle of lubrication down there and you'll be fine. Sometimes it may be some estrogen creams down there. So things like that. So addressing it is important. I always tell people this is so common. People are out there all the time, and there are so many of us who are there to support you. So if you don't go and reach out and ask, you probably are not fixing yourself very soon, are you?
Yeah, and the trauma of trying to figure out things yourself and going through all the layers of guilt, shame, and no matter what.
And also, let me tell you, you're doing this in the middle of complete sleep deprivation and breastfeeding. You're trying to figure this out when you probably have hardly had any sleep with the baby. Like, to be honest, go easy on yourself. We guys are here to help you. So just come and ask, and we probably will throw some 2 cents worth into making your life easier.
Yeah, definitely. And this listener, when she reached out to me, she sent me some pictures of when she was talking on different forums, when she was able to figure something out for herself. So many partners reached out to her saying, I think my partner has it. We did not know this exists, but it has been years and I think my partner has it. What did you do? Where did you go? And a lot of acceptance. Sex is such a huge taboo. It's on all layers of our foundation. When, the couple reached out to a doctor, they were shamed for, it's just in your head. Yeah, it's in your head. Yeah. Why do you think it's a problem at all? Just go back your home. Why are you reading about pelvic floor health and all of that? It was very disheartening.
Dismissive. Yeah.
And to be able to find the right people, I think online forums are great. And to reach out to people, like you said, to reach out to somebody who was able to figure out for themselves, who was able to find the right doctor, you can approach that doctor, and that ways it will help you not go through, the countless number of shaming circles that are out there. So definitely very, very important, Dr. Nivedita.
Can I just mention that, if I were in India finishing my venereology, I would be one of those doctors, wouldn't I? I would be one of those people who didn't ask the right questions. And I would probably be one of those people thinking, what is the big deal? So what if you're not having sex for 6 months? What's all this about? I probably will be one of those people. And I think that is why educating, we talk about educating children, we talk about educating, I think doctors need to be educated as well. We are not taught that way in our medical school, unfortunately. I know we are expecting, doctors should know this, they shouldn't be judgmental, but you should understand doctors also are humans who are also grown in the same cultural background as any of you are. So we doctors in India actually read our text upside down, and we are very good in our clinical skills, let me tell you. Our diagnosis is spot on, our treatment is absolutely fantastic, but what we are also raised with the same cultural background. We are raised with the same, which says sex is wrong, or oh my god, if somebody's having sex, their morale is not right. We are raised in a way where we are connecting people's sexual needs with their morale all the time. And yes, and I think as humans, they need to be taught as well. So I always tell people we should bring in curriculum where we're trying to teach doctors who are first line healthcare professionals sitting there to change their attitude in the first place. When you see a 16-year-old with a wart or something like that in the genital area, well, it's not your business to judge her whether she's having sex or not, because she's 16, her hormone surge is probably really high. So you just have to accept it, and your job is probably to ask the right questions, And doctors, I don't blame them because they're not taught that. They probably are thinking about their 16-year-old at home and freaking out and thinking, oh my God, if 16-year-old people are getting STIs, I'm worried about my daughter. Well, you shouldn't be, because she's probably also having sex. So you should probably give her a condom and do a pap smear. And get the HPV vaccine going and running. So I think even doctors are humans, so they need education. And I really, want to say that, yes, we are all disappointed that it's not a very, sex positive or sex friendly medical atmosphere at the moment. But I'm hoping eventually, if we all are getting taught, doctors are getting taught in medical school about attitude, about culture, about what they need to ask people is, are you having sex or not? Are you married? Do you know what I mean? Yeah. So these things are very important. And I really want to say that, yes, there's lack of education, but lack of education everywhere, right?
Yeah, definitely. And personal biases as well. Like you said, it's a whole lot of work on the person, not just in terms of, the resources that they have, the knowledge.
Yeah.
Right. Do you think the way our generation has been taught about sexual health through pornography and everything also comes into play in not understanding what your body is saying, what's real, what's...
Absolutely, yes. And I think for a generation which has learned sex from pornography, or which have, this is my very famous quote. I tell people, you have to remember, your pornography is like watching Avengers. You cannot watch Avengers and then expect to fly off buildings and throw webs and smash things. And, you honestly cannot do that, because you have to understand, number one, Avengers is a movie. All the people are actors, and they all are, there's graphics that is involved, there's coloring, there's makeup. And this movie that lasted for an hour and a half was probably shot for a year and a half. So that performance that happened in front of you did not happen in an hour, did it? So this is exactly what you have to think when you're watching pornography, because people who are in pornography are actors, and they are probably physically bulking them up, and the way they look, the way they are dressed, there's so much makeup, there's touch-up, there's filters, and there is breaks, and the movie is shot over days. Nobody is performing like that for 2.5. Nobody is performing like that, and the way people's skin looks touched up, the way, somebody's genital area, all pink, all white, no, that's not even normal. For an adult who's been having, two thighs in between your genital, where your genital is, and you're not going to have a white color genital area. What are you talking about? So the whole thing that showed that it's all pink and clean, and, all of that, you have to understand is a movie, and that is not how sex works in real life, clearly. So, and I think that is where sex education or even watching, legal pornography is very, very important because that is more natural. And like I said, sex is a natural instinct, honestly, so you just have to go with your body and your mind, and it works. You just have to loosen up a little bit, not be too stiff about it, and do not definitely try to produce what the porn produced, because you are not an Avenger. And you are not going to be fly off buildings. You have to understand this. You're not going to perform like the guy. And even the size of the penises, I have a lot of patients who are like, what is the normal size? Why? It's all about size. And honestly, guys, yes, some people have larger than others. Some people have thicker than others. Yes. But they're all a normal variant and variety. Like, again, not looking at pornography and 6 to 9 inch long and constantly like that for 2.5 hours is just unnatural. It doesn't work that way. So I think,
we need to learn so much.
Yeah, absolutely.
Yeah, and Dr. Nivedita, we've learned all about vaginismus, how to approach it, how to get it diagnosed, work towards your healing, towards your mental health, etc. Before we let you go, there's a whole lot of sexual health awareness that we all need to undergo. Are there some books you would recommend for our listeners to just for sexual health awareness?
Look, there are some really good books out there for like sex education for children these days. And, you can find them even in Audible. There are really nice sex ed books. And I think sex ed books are different to sexual health books. And I personally, there are a lot of sexual health textbooks and a lot of things that, talk about sexual health. But for a common man without any sexual health, big jargons, purely, explaining what sexual health is or what you need to look for or what, I don't think there is a book like that yet, which probably is a very important thing. It's probably a good thing to do. And I guess we should look into this one. But I might be wrong, but what I personally use is we sexual health clinics and family planning here. We all have a lot of fact sheets that is written in a layman's term, like in a common man's term. And we tend to hand out those fact sheets. So if you're looking, honestly, if people want to know about sexual health, Family Planning New South Wales, that is fpa.nsw.org. And that's an absolutely fantastic website where you can get a lot of information about sexual health. So definitely that's something that I would recommend is Family Planning Australia website. And it's amazing amount of sexual health, reproductive health, STIs, contraception, name it. So definitely feel free to go into one of those websites and have a read.
Thank you so much, Dr. Nivedita, for giving us your time and for letting us know everything about vaginismus and helping spread awareness. Thank you so much.
Thank you so much for having me. It's been an absolute pleasure.
Thank you. That was all we could garner for today's episode. I hope you liked it. An important aspect of today's episode is that this was requested by a listener who felt it was safe enough to speak to us and share their story and request to bring this out for other listeners too, to bring more awareness. If this podcast has created an impact that has been close to your heart, do reach out to us and tell us how else we could serve you. Thank you. You could also follow Dr. Nivedita on her Instagram handle, Dr. Nive Untaboos. Pregnancy series is back, where we discuss what is birth health in the next episode, and the coming seasonal episode is about children dental health with Dr. Pooja. Stay with us for more.